So I've been on neurosurgery wards where I've treated, 80-year-olds that have had, a bleed in their brain, right up to 15-year-olds that have fallen off their skateboard, hit their head, and now have a much less balance and mobility, and so help them get back to where they were so they can go home and go back to school. We definitely do see people in the emergency department when they come in, so if someone has come in with a sprained ankle, it may be the physios that do more of the assessment than the doctors, and then we prescribe them what they need to get home, so if that's crutches or whatever it may be, and then we organise follow-up physio for them as well. What we do in ED as well, we might be part of the assessing team to decide whether they do need to go to MAPU, which is a sort of a 48-hour short stay ward where we think we can get them home quickly, or if they do actually need to be admitted to hospital as well. On top of that, I've been in the rehab ward, so we can see people after they've had a hip replacement and they, just having trouble getting back to where they were before they left hospital. So, we might see people for more like a month or two at a time there, or people that have had a stroke and trying to get them back, increase their function, I guess. I've worked in vascular wards, so people that may lose their leg because they've lost circulation, excuse me, so someone that might have lost their leg after they don't have the circulation, and so then we try and get them into a functional state, teach them wheelchair skills, transfer skills. We do have an outpatient department here, and I've worked there for several months as well, and that was where I would treat things like sprained ankles or people with sore backs and sore necks. So I've done that as well. So basically anyone that is in the coma, their muscles and their joints not doing anything. In a young person, if you're in a coma for a week, it may not be a big deal. However, if you are an 80-year-old, you've already got stiff joints and tight muscles, and you're in a coma for a week or two, when you go to stand up, your calf muscle may be so tight that you actually are unable to, because your ankle can't get that range of motion that it needs so you can stand up. So what we have to make sure that we do is that we make sure that hips don't tighten up and that the ankles don't tighten up and the knees don't tighten up. So what we do is we do passive range of motion. So every day we take each joint of the body through its normal range, so that doesn't happen. So when they wake up and when they are able to stand up, they haven't got any extra factors on top of that stopping that.